You may have been following in the news all the talk about the reduction that will be happening this month and then throughout the rest of the year as all the pandemic supports go away. These people who are on SNAP, the Supplemental Nutrition Program, used to be called food stamps, during the course of the pandemic, those folks were all boosted, their benefits, okay, and you've heard me talk about this. A household's benefits is dependent on their income and the number of households, and then there are that determines how much they get in the way of benefit. Well, what's happened is that during the pandemic, the feds and the state made the decision that though every household would be boosted to the maximum level of food stamps or SNAP benefits that they would be entitled to for the size of their household, regardless of their income. So we've seen a huge uptick in the amount of benefits going out. That ended the end of February. So they would get those benefits at the end of the month, and they would get their regular benefits at the beginning of the month. So families are going to not have this second allocation of benefits that come out the second half of the month. So statewide, the state did a big push out to the communities, out to the recipients who get these benefits, to let them know your benefits are going to be reduced. They're going to go back to the pre-pandemic level at the end of so you won't get that second boost in March. The concern is that, and Irene talked about it, and Supervisor Willie, cost of food has gone through the roof. And so these folks are going to be going back to essentially their 2019 benefit levels in spite of the increase in food costs. So just to give you an idea of what that means locally, 2019, we issued around $11.5 million in SNAP benefits for Ontario County residents. In 2022, we issued $30 million. So almost 3 times as much as we did. So that's a huge effect on not only our recipients, but let's face it, that money flows into our economy locally. So that's about a $20 million hit, $18 million hit to the grocery industry in our communities as well. So, we're expecting a significant push at the level for food banks. So if you start hearing the food banks saying they're running out of money, they're running out of food. Tracy talked about the pop-up food pantry today. I think we're probably going to be seeing more of that than we have, and we've seen a lot of it. So I would expect to see more of a push at the food pantry levels for that. On the Medicaid side, there's been a lot of press around people losing benefits. The reason for that is because during the pandemic, we were not allowed to take any people have to recertify their eligibility for our programs at regular intervals. And during the pandemic, on the Medicaid side of the house, we couldn't do that. They were said, no, just carry people month after month regardless. So because we don't want people losing their insurance. So at the local level, we were doing that. And they were also doing it, remember, most people get on Medicaid through the Health New York website. And so all of those folks also have not been recertified with any length of. So going forward, I believe it's starting in July, we have to start doing those changes. So even people, for example, who are on Social Security, well, and they got a pretty good sized COLA this year. So kind of like, all right, what's that impact going to be on their Medicaid eligibility? And then people who have changed jobs. So we're expecting to see of the people who that DSS is responsible for, we expect to lose some of our people as we have to, at least now we have to look at them at this point in time. There was, heaven help me, there was some talk of us having to go back and kind of do an incremental change. Let's look at what their research would have been here. Let's look at what their research would have been here. Thankfully, they said, no, we'll just take the data that we have now and make fresh determinations here. And then, but also at the state level, as their eligibility expires on that level, there are some of those folks who are going to come back to us. So over the next 6, 8, 12 months, we're going to be seeing this kind of action between us and the state on the Medicaid side. So kind of what the shakeout is going to be, I'm really not sure. So who's going to be where and how many of us there are going to be. But again, at the same time, people who are on those programs that get COLA increases, it's also going to affect their SNAP benefits because their income's going to go up from that. So the programs interact. The financial stuff that happens between the programs also results in people shifting on and off and their benefits going up and down. So I expect over the next, like I said, 6, 8, 12 months, we're going to be seeing a lot of activity going back and forth between programs. People coming on, people going off, benefits shifting. So it's going to be kind of a wild next year or so for us. So just wanted to put what you might see in the paper kind of in context about why that works the way it does.
So Irene, if I'm getting $1 a month and then I got a supplemental pandemic application within that 30-day period, how much of that dollar would I get in my second allocation?
I have no idea. Sorry, that's like way down in the weeds that I don't have any. It's going to depend on your household size. It's going to depend on, I think it may depend on the age of your children.
If everything else is identical, like if I get $1, I've been getting $1 and then the pandemic comes, now I'm getting $1 plus I'm getting 50 cents, let's say.
You'll go back to having $1.
Back to $1.
Yeah. Yeah. Again, that whole second
So
payment
it's a
amount.
100%
Yeah.
elimination of that second benefit.
Right, because it's a federal program. It's a federal program, so they were able to say, everybody's going to be able to go here.
So in the recertification process, is there any ability to compensate for any of that elimination?
No, we go back to, again, the distinction being, we were paying about 11.5 million in 19. I would expect us to land, because incomes have changed and the eligibility criteria change from time to time. The allocate, what credit you get for heat and all those things change. So I would expect that this time next year, I would say we would probably land in the 13 million ballpark. So, but again, that's strictly speculation on my part.
Thanks.